It's the most deadly public health crisis in BC history. The unregulated toxic drug supply has killed thousands since a public health emergency was declared 8.5 years ago, and people are still dying.
We know that prohibition is the root of this issue and a contaminated drug supply.
Researchers say Safe Supply is working, a program that allows doctors to prescribe drugs to those who have a defined substance use disorder.
People who received an opioid prescription were 55% less likely to die in the following week.
But uptake has been limited, especially in rural areas. It's why Dr. Henry says the province should expand the program by offering drugs to those without a prescription. With increased oversight, she believes lives will be saved.
For example, in overdose prevention sites. So there's oversight by the peers who work at that place, some of the supervised consumption sites.
In order to take advantage of Safe Supply prescriptions currently, users have to be considered substance dependent. Dr. Henry believes there's hundreds of thousands of drug users who don't meet that threshold, and removing the prescription barrier would give them access to safe drugs. For the province, the idea is a non-starter. BC United and the Conservatives also shot the plan down, both calling on the Premier to remove Dr. Henry from her position. The BC Greens were the only ones siding with the health professionals.
I am so dismayed that the conversation is really focused on dehumanizing people who use substances and on politicizing what is and has been a declared health emergency since 2016.
Henry's report echoes the findings of former Chief Coroner Lisa Lapointe, who said in November of last year before leaving her post that prescribed safer supply wouldn't solve the crisis.
Let's keep those people alive until we can provide all of the other supports.
That too was quickly shot down in January.
I do not believe that the distribution of incredibly toxic opioid drugs without the supervision of a medical professional in British Columbia is the way forward and the way out of the toxic drug crisis.
Dr. Henry says the toxic drug crisis is getting mixed up in other issues like post-pandemic stress and inflation, the housing crisis, and an increase in visible homelessness.
It's very simple to blame it on things like those people who use drugs.
A conflation of social issues with a medical crisis that Dr. Henry says is stalling solutions while people die.